Expertgruppen för biståndsanalys, EBA, är en statlig kommitté som oberoende analyserar och utvärderar svenskt internationellt bistånd för att det ska kunna förbättras och utvecklas. EBA har 10 ledamöter med kompetenser från olika biståndsområden och ett kansli som verkställer besluten. Förutom våra rapporter så ordnar vi seminarier, workshops och möten mellan olika parter. Varje år sammanfattar EBA sin verksamhet i årsberättelsen Biståndsanalys. Den kan beställas från kansliet eller laddas ner på eba.se. EBA har ett oberoende i relation till uppdragsgivaren regeringen, liksom i relation till vad som utvärderas, samt till de rapportförfattare som anlitas. Rapportförfattarna ansvarar själva för slutsatser och rekommendationer i sina studier. Allt vi producerar som rapporter, seminarier och vår podcast EBA-podden finns tillgängligt på vår hemsida.
Good morning and welcome to this EBA seminar, Social Protection in the Global South, the Role of Foreign Aid. My name is Hårsmar. I'm Deputy Managing Director at EBA, and I will guide you through the seminar today. We will launch a report today, which is available on our web page, www.eba.se, on this theme. Social protection, be it child care compensation, old age pension, cash transfer programs, or other, is a modality that is both well-researched and thoroughly evaluated. We know that social protection has positive effects on poverty reduction in its various dimensions. It may also have positive indirect effects on economic growth. Hence, those who search for results in developing cooperation ought to look in the direction of social protection. But the question behind this study is slightly different. If now social protection has positive effects, is it also a good idea to support it through aid interventions? And an even wider question is what factors may explain the introduction of such programs, especially in sub-Saharan Africa, where the social protection coverage of the population is the lowest in the world. The reason this study focuses on sub-Saharan Africa is also that aid to social protection increasingly is being channeled there. So should donors support the growth of social protection schemes in sub-Saharan Africa? And if so, what type of support is most effective? These are the kinds of questions we'll dwell on in this seminar. So a note first, the data available only allowed for a study up to the year 2020. So the effects from the COVID pandemic on the spread of social protection programs is not covered here. And when we talk about social protection, we use the broad definition from the ILO that social protection is a set of public measures that are designed to reduce and prevent poverty and vulnerability across the life cycle. These public measures include distinctive policy strategies within social insurance, social assistance, and labor market regulation, hence a very broad definition. But the main focus in the report is on non-contributory social assistance. For those of you who follow us on Zoom, you may pose questions to the panelists through the Q&A function in Zoom. But we now listen to a presentation by the main author, Miguel Niño-Zarazúa, who is Senior Lecturer at the Department of Economics at SOAS University in London, but also non-resident Senior Research Fellow at the UNU-wider UN University Development Economics part in Helsinki. Miguel's research concerns social protection, fiscal policy, labor market policies, poverty and inequality, among others. Miguel has done this study together with Ana Horigoshi, Alma Santillán Hernández, and Ernesto Tiburcio. So, Miguel, the screen is yours.
Well, good morning, and thank you for joining this webinar. I'm very pleased today to present this study. that was conducted jointly with my colleagues Ana Horigoshi, Alma Santillán Hernandez, and Ernesto Tiburcio. And we also want to thank the expert group of AIDS Studies for financing and supporting this study. And I also want to thank in particular Lisa Hjelm and the reference group integrated by Joachim Molander, Jimmy Adesina, Marion Ouma, Rika Long, Stephen DeBro, and Paul Quarles van Ufort for very useful comments on early versions of this study. And I am also very grateful to Marcus Burman, Mats Hårsmar, and Emma Helsborg for organizing this webinar, and I really look forward to the discussion. So just let me start by talking about the rise of social protection in the Global South. Over the past 2 decades, social protection emerged as a new paradigm in the fight against poverty and vulnerability in the Global South. It expanded really rapidly, just for a handful of programs in normally middle-income countries, to nearly 200 programs currently operating at a large scale in about 130 low-income and middle-income countries. So it has been a very dynamic process. But recently, the COVID pandemic and the devastating economic and social consequences usually brought about by lockdown measures exposed the significant gaps in access to social protection across the Global South. And the pandemic also exacerbated the structural inequalities in access to social protection and also impacted more disproportionately informal workers, the poor, and marginalized groups that are largely uncovered by social protection, especially in low-income countries. And these events also underscore the need to expand the coverage of social protection to better protect vulnerable populations against not only idiosyncratic events, but also aggregate shocks. So in this study, we adopt a definition of social protection that reflects a set of public measures that are designed to reduce poverty and vulnerability across the life cycle. These public measures include very distinctive policies within social insurance, social assistance, and also labor market regulations. Social insurance, which is more common in industrialized countries, includes contributory schemes designed to protect workers against life course events and also war-related contingencies. Social assistance include tax finance and also donor-funded policies designed to address poverty and vulnerability. Labor market policies and regulations also are legal frameworks that are aimed to ensure minimum employment standards and safeguarding worker rights. So in this study, we focus in particular on social assistance because these policies represent the most important changes to social protection systems in the Global South. So as you can see in this figure, which is on the screen, conditional cash transfers, for example, Brazil's Bolsa Familia, non-contributory social pensions, such as Lesotho old age pensions, unconditional cash transfers, such as South African child support grants, and also public works programs, such as Ethiopia's productive safety net program, are really prominent examples of this wave of social protection. Now, nevertheless, the pace at which social protection has expanded, as well as the type of programs that have been adopted to protect specific populations, vary substantially across the Global South. In the table that you can see, the color scale in this figure captures the distribution of social protection coverage from dark green, indicating the highest coverage, to dark red, measuring the lowest coverage. And then, as you can see, Sub-Saharan Africa remains the region with the lowest coverage across the world, with only about 15% of the regional population covered by at least one area of social protection. And this is followed by Southern Asia and Southeast Asia. But also within world regions and countries, there are substantial gaps in coverage across different populations. in sub-Saharan Africa, as you can see, about 30% of the population in old age is covered by old age pensions, but only about 8% of those living in extreme states of vulnerabilities, like extreme poverty, have access to social protection. So this also underscores the needs in this area of policy. Now, prior and during the recent evolution of social protection systems, low-income and middle-income countries witnessed important economic and political developments that reshaped the state-society relationships and also the interactions with domestic and external actors, including institutions, obviously, but also donor agencies. In the area of development assistance, one can see in this table that aid that is targeted at supporting social protection has historically captured a very small fraction of global aid's budgets, just about 2% of total official development assistance. Although in absolute terms, these flows have increased approximately by 60% between the mid-1990s to 2015 and 19 period. But at the same time, this table shows that in relative terms, aid flows measured as percentage of total aid has also, in fact, experienced a decreasing trend, in particular from bilaterals and multilaterals agencies. Swedish aid is perhaps one of the exceptions in which we can observe an increase pattern in aid allocations, in particular since the mid-2010s. So, given the socioeconomic conditions that prevail in many aid recipient countries, the influence of donors via foreign aid and other channels can play a very important role in shaping the institutionalization and development of social protection systems in the Global South, and this is precisely what we want to address in this study. In this study, we conduct an international comparative analysis to examine the role of foreign aid in the development of social protection systems in the Global South. And in doing so, we pay a particular attention to sub-Saharan Africa. So this study asks several questions, but in particular, the question is, has foreign aid contributed to the development of social protection systems? And if so, how? And under what conditions does it work? So we also want to understand what other underlying factors have contributed or hindered the recent evolution and expansion of social protection systems. And also we want to understand what is the existing evidence indicating these patterns. In order to do so, we conducted a series of methodological approaches, like an statistical analysis of aid to social protection. We also conducted the first new systematic review on this particular area. And then we also conducted an international comparative analysis based on advanced econometric methods. And I invite you to read the report where we describe in detail our empirical strategy. So let me just talk a bit about the recent trends of aid to social protection. As these figures show, multilateral organizations have been the largest contributors to social protection aid at the global level since the early 1990s. And they have contributed substantially to the development of these systems. The dominant influence of multilaterals, it is clear, in contrast what we observe in development aid, where usually bilaterals have been much more prevalent. Multilaterals contribute to about 2/3 of aid budgets since 2010, and with an average of approximately $1.3 billion per year. This measured in constant prices, which means we keep inflation over time. So the World Bank has been perhaps the dominant actor in the sub-Saharan region, followed by the Asian Development Fund, UNICEF, the ILO, and also the African Development Bank. So the strong influence of multilateral institutions, in particular the World Bank, has meant that debt instruments such as standard loans and reimbursement grants have played a very key role in financing the recent expansion of social protection systems. So while conditionalities of debt instruments vary substantially across countries, they can influence or can be influenced by donor priorities and agendas that can in turn also influence the design features of these programs and also shape the configuration of social protection systems. Multilateral organizations such as UNICEF and the ILO have been also prominent in leading, for example, the influence of the expansion of social protection systems through the provision of technical assistance, policy diffusion, and policy dialogue. Also, qualitative evidence that we collected throughout this study suggests that while bilateral and multilateral donor agencies engage in dialogue and exchange of ideas, very often policy agendas are more actively advanced by multilaterals, which have a distinctive corporate objectives. And as implementing agencies, they have also active engagement with national governments and key local stakeholders. And this doesn't mean that bilaterals don't play a very important role, but obviously multilaterals are in this comparative advantage in this particular respect. In this slide, the graph on the left-hand side shows that multilaterals rely more on debt instruments to distribute aid to social protection, while bilaterals rely more on grants to support and finance social protection systems. In terms of aid modalities, the figures on the right-hand side show both bilateral and multilateral aid are concentrated in project-type interventions, usually devoted more than half of total distributions to social protection through this aid modality. So multilaterals rely on budget support as well and technical assistance to support social protection, while bilaterals channel a significant proportion of their operations via core contributions, pool programs, and funds. So one of the things that we also observe is that the preference of project aid over other modalities, such as budget support, are in a way symptomatic of broader considerations that relate to governance issues, state capacity, and foreign policy strategies that all underpin the relationship between donors and recipient countries. Also, qualitative evidence indicates that donors limit budget support operations because very often they have concerns about corruption, rent-seeking behavior, and overall absence of programmatic policies in aid recipient countries. So there are certain modalities that in a way facilitate restricting these kind of concerns. And furthermore, with increasing focus on low-income countries and fragile states, many governments in donor countries, and Sweden is a very good example in this case, are very often reluctant to be seen as supporting regimes that, for example, abuse human rights and govern in an autocratic manner. So cooperation here is very key, and also that explains as well why multilateral aid has been a very important channel, which is certainly funded and supported by bilateral agencies. In this next slide, we can look at how aid flows are distributed across countries and by different groups, in this case, regions. But also in the report, we report the distribution of aid in per capita terms. And we also observe a significant difference between bilateral and multilateral aid. Multilateral aid, for example, has been distributed among upper middle income countries and lower middle income countries in particular, while bilateral aid has been distributed largely among low middle income countries. So aid to social protection has been also cyclical, as you can see in this graph, spiking in response to aggregate shocks, such as the financial crisis in East Asia, for example, in the end of the 1990s, and also more recently due to the financial crisis of 2008 and 9. Also, aid to social protection has spiked during prices shocks like the world food crisis of 2008 to 2009. So, as you can see in this graph on the right-hand side, between 2009 and 2011, aid to social protection witnessed a large increase, the largest increase over the period under analysis, especially among upper middle income countries and lower middle income countries, reflecting also countries' increasing demand for resources to scale up and reform social protection systems in response to the global financial crisis. And the increasing demand for social protection also coincided with emergency situations arising for the food crisis, as I mentioned it earlier. So the fact that the bulk of multilateral aid distributed to address those financial shocks, in particular aid from the World Bank, which was channeled to middle-income countries, which already had social protection programs and systems in place, also really underscores the importance of building social protection systems in order to utilize these systems and policies as counter-cyclical instruments in times of crisis. And this is because many low-income countries were unable to absorb social protection aid during those shocks because they had not been with social protection programs to scale in those years. So the increasing focus on low-income countries and fragile states, particularly in sub-Saharan Africa, makes it work also in this area more challenging and complex. These challenges are also symptomatic of the precarious conditions at various levels, including administration. So, for example, it's the limited population registries and the professionalized bureaucracy. So there are limitations at program levels. So they are very often dysfunctional and ineffective delivery systems. And also at the policy level, with limited resource mobilization capacity and fiscal space to sustain programs and systems to scale. So in a way, this explains the stronger need for coordination and harmonization between bilaterals and multilaterals in the process of assisting social protections in the past decade. So I want to move on to the main question of this study, which is, has aid contributed to the expansion of social protection systems, especially after knowing the important trends in recent years to support those systems? So in the next slide, we address the main question, which is whether these systems have, in fact, contributed to the expansion of these systems. So in order to do that, as I was mentioning, we conducted several methodologies, and I will not discuss here in detail these methodologies, but I would want to focus in particular on the results from the models that reflect and capture better these dynamics, which especially account, for example, for countries' populations, and also deal with the simultaneous correlation in this kind of policies between social protection aid and countries' budgetary requirements for redistribution. No? So we address many of the things which are related to the endogeneity of these factors. And to give you just a summary, our results indicate, and we conducted several tests to validate our findings, and the results indicate that foreign aid has had a positive and statistically significant effect on the expansion of social protection systems in low and middle income countries. So overall, in quantitative terms, we find an increase in social protection aid by, let's say, 1 percentage point increase leads to an increase in the share of a country's population coverage by approximately 0.25%. And I will explain how we can interpret this. But social protection aid from that countries appear to obtain the largest impact on social protection systems at the global scale. But in sub-Saharan Africa, the effect of aid is also important at the from global aid, which means all donors together, and also multilaterals, which is no surprising given the sphere of influence of multilaterals in the region, as I was discussing before. And the size of the effect is also considerable, in the order of 0.26% in relation to one increase in foreign aid. No, so, and this is giving supporting evidence of this positive effect of aid to the scale of social protection systems around the world. So the insignificant effects of bilateral in sub-Saharan Africa could be associated with a number of reasons. In particular, the likely lack aid effects, which means that the more recent, or that reflects the more recent and therefore shorter bilateral engagement with social protection systems in sub-Saharan Africa. So, which means that we are not able to capture the actual effects because the time of interventions are still very short. And this is relative to the longer history observed in other world regions that show a significant impact. And the other potential reason is that also bilateral aid relies heavily in the region on project aid and grants, which carry perhaps the risk of reducing domestic resource mobilization and also crowding out public spending on social protection. So, and this is something that we also need to investigate a bit further. In order to interpret our findings in this table, we provide an economic interpretation. And in this table, we present the effect of 1 percentage point increase in social protection from the global sample of social protection coverage among top 5 recipients of social protection aid in sub-Saharan Africa, Latin America, and the Asian Pacific regions over the period 2015-2019, which is the last period that we have data. And if we take Ethiopia as an example, we see that 1 percentage point increase in social protection aid from an annual average budget of $253 million, as you can see in this table, which is surrounded by this red circle, would lead to an increase in coverage of approximately 260,000 beneficiaries from a baseline of 8.4 million people currently receiving welfare benefits in Ethiopia. So, which is not negligible. So the results also reveal a degree of variation in the impact of aid, which, keeping other important factors constant, is likely to be contingent upon the unit cost, for example, and design features of transfer programs, and also the way in which governments and agencies implementing these programs achieve economies of the scales, and that can also support the expansion of these programs. The results also reveal not only a considerable variation in the scale of social protection, but also a marked unequal distribution of aid budgets, even among top 8 recipients in sub-Saharan Africa, for example, ranging from, as I was mentioning, $253 million in Ethiopia in that period to $64 million in Uganda. And this variation is irrespective of the relative low level of public spending on social protection and the high level of dependency of aid to finance government spending in these areas, especially among these countries. In Malawi, for example, 38% of public spending on social protection is funded with aid money. So it's a reflection of the small rate of coverage and also the limited public resources that are allocated to support social protection systems in that country. So, and this is not just unique about Malawi, but it's also systematic in other countries in the region. So the fact that the results point to a significant positive correlation between government revenues and the scale of social protection systems also underscores not only the vital role of aid in supporting and in many cases sustaining these systems in sub-Saharan Africa in the short, medium term, but also highlights the importance and the relevant role that aid can play in strengthening the capacity of governments to mobilize resources that are essential to finance social protection spending in the longer term. So, just to conclude these remarks, we can summarize our findings in highlighting that the empirical analysis has pointed to a positive contribution of international aid to support the adoption and subsequent expansion of social protection systems across the global south. And this positive effect holds across different conceptualizations of social protection aid, although our findings suggest that policies that target directly at the expansion of these systems have a greater impact. So the results also are broader consistent with what we expected and with the scant literature that has investigated the impact of aid on social protection systems. And also I think it's important to underscore that we don't find evidence of a detrimental effect of aid on the evolution of these systems, although there is a marked unequal distribution of aid budgets in respect of the level of vulnerabilities that countries face across the region. So this is an issue that requires a more careful consideration when donors approach coordination efforts between especially bilateral and multilateral alliances. So how to deal with this unequal distribution of aid monies. So the composition of aid type and finance type also seems to matter, as well as the channels of aid disbursement. So the fact that over 2/3 of social protection aid in sub-Saharan Africa is channeled via multilaterals and executed largely through debt instruments signals a greater engagement of African governments in the development of social protection systems, which is something really positive. Bilaterals rely more on project aid to allocate aid primarily in the form of grants. And while these strategies mitigate the risk of regime capture of aid budgets, which is obviously a very important consideration, especially in contexts where regimes are autocratic or they are seeking to capture aid funds, these strategies can also potentially undermine domestic resource mobilization efforts that support social protection spending in the longer term. So the question of how to assist low-income and middle-income countries, especially those with high dependency on, for example, commodity exports, like is the case of many countries in sub-Saharan Africa, and how to help them to utilize social protection to respond to and mitigate the effects of aggregate shocks will require not only financial support to expand these systems, but also building tax collection and welfare delivery systems that enable governments to respond effectively to this kind of crisis. And we, in our study, we remain cautious about arguing in favor of certain modalities or types of aid over others. However, building in parallel the fiscal capacity of countries is, I think, perhaps the most effective way of securing the long-term sustainability of social protection systems in the global south. So overall, the study concludes by making the case for and also emphasizing the importance of continuing to provide support to building social protection systems, preferably in parallel with aid interventions to support, for example, the development tax collection systems that I was mentioning before, which are critical to achieve the long-term sustainability of these systems. So thank you very much for listening, and I look forward to the discussions. Så tack för att du lyssnar.
Thank you very much, Miguel, for this rich and clear and informative presentation. We'll come back to some of the issues you raise here, but now I'd like to introduce the panel. The panel members are Marion Ouma, who is a social policy specialist with research experience in social protection, politics of African development, policymaking processes. You currently hold a postdoc position at the Nordic Africa Institute in Uppsala, but you're also a research fellow at the University of South Africa. And there you are affiliated with a research initiative on social protection. And Miguel, we've already met you, so I don't introduce more. But then Lisa Hjelm is with us as well. Lisa is a social protection advisor at the Africa department at Sida, Swedish International Development Agency. Previously, you were my colleague as a program manager here at EBA. And there, here at EBA, you contributed to a report on social protection for refugees and internally displaced people. And for the sake of clarity, we should also say that in the beginning, you were project manager for this very study, but then you left and went to Sida. You have also previously worked for UNICEF and World Food Programme on social protection. So all welcome. Maybe I start with you, Lisa, with a question. We've learned now from Miguel that aid promotes the buildup of social protection programs. But what is the motivation of Sida in this? Why do Sida support social protection? What specific role does Sida have in this? Please, Lisa.
Thanks, Mats, for the introduction and for the question. And first, to start off answering what is the motivation? When we talk about social protection at Sida, we always have the human rights aspect as the starting point. And this right to social protection, it's included in several UN conventions, and it is also highlighted in the SDGs with 3 specific targets. So that is really the foundation and the starting point. But another very important aspect is that there is now an overwhelming amount of evidence that social protection is an effective tool for poverty reduction. And as we know, this is the foundation for Swedish development cooperation to improve lives for people living in poverty. And the cooperation policy also highlights the importance of social protection, specifically for reducing inequality, vulnerability, and poverty. So that is, I think, the short answer to the motivation. But then when we think about what is our role, and we're very happy to now read this report and to see that foreign aid has actually contributed to the development and expansion of social protection. But when we think about social protection, we think about different ways of working towards universal coverage of social protection with support through the life cycle. Both at the global level and at the country level. And at the global level, we contribute to evidence generation, capacity strengthening, and support to global dialogue and coordination. And at the country level, the support will depend a bit more on the needs and conditions in the country and what is already in place. And the approach will look quite different in depending on how developed the countries and what systems are there. But typically, when we have 5 different things that we normally include in the support, and that is first to advocate for social protection as a human right, as I mentioned, also as a motivation to why we work in social protection. We work in system strengthening and support to institutional development. Also, as was highlighted in the report, we engage in dialogue around sustainable financing, and we contribute to creating links between social protection and other sectors. And finally, an area that is becoming more and more important is support to development of adaptive social protection that can support people when they face sudden large-scale shocks or crises.
Oh, this, Lisa, sounds fantastic, very good, etc. But I think we'll try to complicate things a bit now. And I turn to Miguel for a question here. You know, we have this focus on sub-Saharan Africa. You said that increasing amounts going there, money, but as a share of total aid, social protection gets a smaller share, decreasing. Is it more difficult to build up social protection programs in African countries than elsewhere?
Well, thanks, Matt, for the question. I think certainly the fact that during the last decade, the focus has been on low-income countries and fragile states increases the level of complexity. You know? And I think there is a justification for focusing on low-income countries. This is where demands for supporting vulnerable populations is very high, no? And certainly there are strong justifications to do so. Many low-income countries also face different challenges, no? Sometimes still fragility, conflict, also limited capacity to implement policies at the national level. So certainly there is a variety of complexities here. And this is where I think donors can play a very important role. You know? But I think it is really important to engage with governments in making sure that those efforts become institutionalized, you know, and become embedded into policies, into laws and regulations. So we ensure that these interventions don't become tools for clientelism, you know, and that can reproduce also and be really supportive to undemocratic regimes. You know? So I think there is a lot of elements there that I think we have to think.
And I think, Marion, you've studied the Kenya case specifically. And there, if I understood correctly, you found that donors made it possible to support social protection or intervened by convincing various actors within government and in non-governmental actors. What lessons do you draw from that? It seems that it's not only the financing that is around here, but also advocacy from donors. What does that mean?
I guess, I mean, Kenya is a case, yes, that I study, but I think the lessons then replicate across the continent on countries that have adopted social protection and social protection programs in the last 20 years. So Ghana, for example, Zambia, Malawi, and so on, Uganda, Tanzania, and the other countries too on the continent. I think, first of all, I think the lessons that we learned, I think donors then catalyzed the development of social protection and expansion of social protection through various pilots that were done across the continent, you know. And I think there are actually quite many, if I was to say, there are quite many pilots that were done on the continent by donors to get governments in Africa to adopt cash transfers. But I think one of the things that we learn is how social protection has been promoted. First of all, I think I would think about the way social policy has been reduced, first of all, to social protection, but then further to cash transfers. Because across most of the places, countries that have adopted cash transfers recently, what you hear when people talk about social protection, they refer to cash transfers rather than broadly social policy as we know it or social welfare as we know it. So I think one of the lessons we learn is that there is the risk of minimalization of instruments for poverty reduction and welfare improvement when it is donor-led, you know, when the process is donor-led and it's done from a top-down approach, yeah. But then still, I think on the other hand, governments have this space because they are legitimately elected. Governments have had the space to express themselves in the way they want the social policy to be or the social protection to be. But I think the lessons that could be learned is how top-down processes, for example, are adopted at country, especially when there is financing, which we know is a big incentive. Donor financing, it's a big incentive to how then countries adopt programs and the space that there is for countries. Yeah.
But both you and Miguel talks about this move towards projects to sort of limiting the interventions in a sense, and Miguel warns for this and asks for a broader approach. What does this mean for long-term financial sustainability? Is there a risk that donors push in a direction which is not financially sustainable?
That could be a cause of. Sorry, was this correct?
I also encourage all of you in the panel
Miguel,
to
maybe
jump
Miguel
on the
can
questions.
go first, and then
let's go, Marion, please.
I mean, I guess that's the fear. That's always there. That then when donor priorities change, then it compromises in-country financing. So I think that's a fear that we have to, it's a reality that we have to think about, but also that where there is financing, there is always the issue that donor priority will take center stage.
Miguel, do you agree with Marion on this?
I mean, yes, I mean, certainly, I think that if we think now about the sub-Saharan region, there is certainly some challenges in terms of tax revenue collection, no? So, and if you think about what would mean or the cost of implementing these policies to cover all the populations, which is the aim of, I think, many governments in the end. At the moment, many or very few countries have the revenue capacity to implement them. No? So if you conduct multiple analyses and do simulations about what would be the cost, I mean, in the region, implementing these policies to cover all the citizens will amount to about 5% of GDP in all the countries. But if you think about what countries collect, it can vary from 20%, for example, in Guinea to about 40% in Ethiopia. No, so the fiscal cost is substantial, and I think here is when the support to implement tax revenue strategies is very important. Simply because there is a lot of spending in the region which is very inefficient. So many countries have highly regressive subsidies, for example, that can also undermine the ability of countries to implement more efficient policies. And also, obviously, there is what Marion was referring to, no? These the political dimensions, which are incredibly important. No? So how to deal with the opportunistic behavior of incumbents. No? So, but certainly there are ways of doing that, and we have experience from the history about how to go around this, from other regions as well. So I think there is a certain number of strategies that countries can certainly explore to depend less or become less dependent on aid, to actually have a more broader approach to social policy, as Ouma, as Marion was mentioning, rather than just focusing on cash.
Okay. Lisa, we are not putting Sida on the spot here. It's not that you should respond for Sida, but there are, it seems, real challenges here with countries in sub-Saharan Africa. If we think of the criteria for least developed countries, those are countries that are more exposed, categorized as such, because they are more exposed to external shocks in economic terms and environmentally. They're more vulnerable than other countries. 32 of 46 LDCs are in Africa. So we know that it is a continent with problems. Do Sida try to target these countries specifically? And if you do that, how can you work in a country like Somalia, Mali, or Burkina Faso with social protection?
Thanks. That's a very good question. But first, I also wanted to add something on the discussion around we talked about the cost for social protection. But I also think it's important to keep in mind what is the cost of not investing in social protection. And here, I believe that there is a lot of evidence already showing the impacts on social protection programs, but we probably need even more evidence and knowledge what it would mean not investing in social protection. What would that mean for future generation in those countries? So as opposed to cost, also think about social protection as an investment. So the question around how do we work in the least developed countries and the fragile countries? We know that large-scale shocks are becoming more frequent and more protracted. Fragile conflict and crisis affected countries with increasing humanitarian needs, they also have the lowest social safety net coverage. And we also know that there has been a global commitment for better engagement between the development sector and the humanitarian actors, and to strengthen these links. And this, even though it is challenging, this is also important because we know that going forward with the climate crisis, shocks will become more and more common, and humanitarian support will need these systems to as a foundation to continue to provide the support that is needed. So from Sida, we work in, for example, some of the countries that you mentioned, Burkina Faso, Mali, Somalia, and there are different approaches for, even in these countries, working with systems building and systems strengthening. We often work through multilateral organization in this work, as it may be difficult to work only through government systems, but it is still important to involve the actors that are there to make sure they are becoming more sustainable with a combination of actors that are in place to look at what is there and what can be built on and what can in the future be something that can be used both for regular support and for humanitarian assistance.
I have two questions I'd like to ask now. We take one in a row. The first one, if we go with, you say that you work with multilaterals, but the coalition of donors that push for social protection system, as we learned, they are not always in agreement. For instance, the UNICEF and the ILO push for unconditional cash transfers, whereas at least earlier the World Bank pushed for conditional cash transfers. Conditional means that you, for having money, you urge people to send their kids to school or something similar in order to break the intergenerational poverty cycle. Unconditional, you hand out the money. What can that lead to? Sida works with multilaterals. How do you see this in specific countries? Is it a choice to go in between those, or how does that play out? Whether you go with unconditional or conditional, for instance, or any other of these aspects that differ between the multilaterals.
Yeah, and of course, Sida decisions are based on a number of different factors and based on the context and analysis that is done in the country. But I would also like to add that even though the donor community and different organizations may not always be in agreement, I would say that there has happened quite a lot in this area, at least at a global level. For an example is a global partnership for universal social protection, 2030, it is called USP 2030, is co-led by ILO and the World Bank. And this coalition gathers countries, donors, and international organizations to discuss and work together around different questions and challenges relating to development of social protection. And to continue on that, my impression is that the different organizations often have a lot in common and share the same overall goals when it comes to social protection, but have, I would say, important differences when it comes to mandate and functions, because we want to have difference as well. And from Sida, we support the organizations that you mentioned in different countries, and it depends on what the needs are and what the sort of route to our goal, which is universal social protection throughout the life cycle, what that looks like in that specific country.
Marion, do you have any opinion or idea about the role that different multilaterals play? What is your perspective on this? Is there a unanimous voice pushing governments, or are there fractions in that push?
Yeah, I mean, I guess with just as Lisa said, the different donors and different kind of relationships between governments and the multilateral and the bilateral organizations, and therefore you see different kinds of support, different kinds of priorities, and so on. And this differs maybe, for example, from the way World Bank would push for a certain instrument than maybe Sida, for example, because the World Bank, because of the way it's structured and its relationship with the governments, then is different from what maybe Sida has, what UNICEF and ILO do have. And so there would be differences in those relationships, and what is, first of all, what's promoted and how it is promoted also.
Yeah. Then, what to all of you, what can we say about this distinction between conditional and unconditional when donors are active in sub-Saharan Africa? Is it one or the other that dominates as a main approach? Miguel.
And thank you, Mats. So, well, I mean, obviously there's a lot of discussion about the conditional features of CCTs vis-a-vis unconditional ones, and they are on the micro level. So how these affect behaviors and impact different outcomes, which I will not discuss this here, but there is plenty of evidence summarizing what we find. And overall, CCT seems to be more effective for several reasons. But obviously, the issue with conditionalities can be contested, no, for several reasons. But I think what I wanted to mention is that we also know from analysis that has to do little with the impact of CCTs vis-a-vis unconditional cash transfers is that overall CCTs are more prevalent among electoral democracies. No, autocracies tend to implement more often unconditional cash transfer, and there are good reasons for that. No, so very often CCTs require certain levels of programmatic levels of institutionalization, and while unconditional cash transfers in the region are very often implemented with limited programmatic characteristics and deliver without, for example, a clear regulations or, under the idea of entitlements, no, or rights of citizens to be eligible to access these kind of services. And they are more aligned to certain kind of benefits that the incumbents provide to the electorates. No? So, and therefore they are more likely to be politically manipulated by authoritarian regimes. So, and this is one of the comments I want to make.
Yeah, and on that, okay, Marion and Lisa like to come in. I'll just remind all the participants on Zoom, there's a Q&A function that you might use and write your questions there, and we'll take them later on. Marion first, and then Lisa.
I guess the discussion, I mean, what Miguel has said, and also thinking about unconditional cash transfers and conditional cash transfers, is that the conditional cash transfers have then with them this notion, this paternalistic notion that the poor or poor people then have to be told, or they have to be forced to do a certain thing, which is very paternalistic, and there's no evidence to that, because everybody wants to take their children to school. Everybody wants to see their children have good healthcare. So in cases where you have conditional cash transfers and with conditional cash transfers or conditional programs, then there is that paternalistic notion. But I guess beyond that, I think now we talk about conditionality, I think there's also the conditionality of aid, because the project is on aid. So there is also the conditionality of aid that has acted to shape social protection, which I think we should look at, what are some of the organizations that have put conditions on countries in Africa, especially to adopt certain kind of programs, and we have those cases where through donor financing is used as a bait through a carrot and stick approach to get governments to adopt cash transfers. So beyond the household level where you have unconditional cash transfer, we also have conditionality at national level too.
Yeah, thanks for raising that. Lisa, what do you want to say?
What I wanted to say related to this discussion is that we know that unconditional cash transfers alone can have impacts on a number of different outcomes, and from an administrative aspect, it may be preferable many times. But we also know that cash transfers is not a sort of silver bullet for eradicating every type of multidimensional poverty. So there are other services needed as well, and from Sida, we often support a combination of cash programs linking to other services that we call sort of cash plus programs. So that is not it's not conditional, but is aiming at expanding the impacts from the program through linking to other services. And there was. Let's stop there.
So this broader approach is important. If we now link back to the question of how to work in these really difficult, fragile countries, countries where the government is not really a government that you'd like to work with, or it's difficult to approach, etc. Miguel, you mentioned, you brought this up, that there are certain structures that tend to come up here, but you also mentioned that there is a possibility to learn from history here. What did you mean by that? I think you might refer to some other countries outside of Africa in that respect.
Yes, when I mentioned the experience of history, it was in relation to how to mobilize resources. So obviously we can think about the experience of history or the lessons that history can give us in terms of supporting countries coming out, for example, of conflict or being in a very severe state of vulnerabilities. In relation to this first point about how to deal with the limited physical space and what kind of experiences we can learn from, well, there are multiple ones. And I think that, for example, if you think about the way revenues from natural resources are usually used in the region, I think there is a waste to make sure that those resources are used in a more efficient way. And there are plenty of examples there. But also, when we think about how many countries deal with extractive industries in the region, very often the contracts that underpin this kind of activities are very exploitative. No, so for example, Bolivia implemented they decided to renegotiate some of these contracts that were not very favorable for the country, and this simple action of renegotiations of contracts allowed Bolivia to implement the Bono Juancito Pinto, which is a cash transfer to support schooling, and also Renta Dignidad, which is old age pension. No? So you don't have to implement drastic policies, but sometimes you're thinking about how you have done things in the past can really help increase the fiscal space. No? Also, as I was mentioning, countries have very regressive subsidies. Mexico had very regressive food subsidies in the past, in the 1990s and before. And then by undoing these subsidies, they were able to finance Progreso in those years, no? Which was one of the main cash transfers in Latin America. But also here there's the political dimension of it. In 2012, Nigeria tried to undo a very regressive fuel subsidies, and in the way they did it, they didn't offer any compensation for those losers, no, of this political change, and then the government failed to undo the subsidies, and they have to put them back, no. So these are the things that the experiences that can be illustrative about how to increase the fiscal space in this particular area. There are other examples about the past that can support the implementation of policies in the context of fragility, and also we can discuss this if you want.
Yeah, I think we should open up a bit for questions from the audience as well. There are a few coming in, but Marion, first, the way donor support is perhaps something to think about as well. You have some ideas about technical assistance and capacity building, which is a common way of supporting. But we seem to have done that for quite some time, is it?
Yeah.
And what do you think about that?
I guess it's a question that needs to be asked. That I mean, we've had capacity building and capacity strengthening, especially for African countries, for 20 years on social protection. And so the question I always ask is, are African countries and governments really that dumb that they need support and to be taught how to run social protection for more than 20 years? Clearly, there are questions to be asked here. But I think the way support should come, maybe, I mean, the resource in terms of how to support broader social policy and not just social protection, how it should come, I think first of all, we need to think about the structural reasons that hold governments in Africa from having, the kind of finances, the fiscal space that they need. And I think Miguel alluded to this. I think the issue of illicit financial flows could be one, is clearly one that we know that needs to be handled and need to be considered, because there's a lot of flows, there's a lot of financing that's coming out of Africa, out of countries in Africa through various means that are going elsewhere, which could actually be put potentially into building social policy frameworks. We know there are unfavorable trade relations, which are really structural in globally. Unfavorable global trade, which if they were more favorable to Africa and countries in Africa, they would increase finances. So I would think about it from a very structural level in that sense. In terms of increasing resource for social policy in Africa.
So you open up for the really big questions and challenges here. So it's a tall order, yeah. Now we are have some questions from the audience, and these are for all of you in the panel. So anyone can start. We start with a question from Edith Cabalira. How do you deal with high corruption levels in recipient countries? And how do you ensure effectiveness of social protection programs with such issues? So really, really tough question. Who would like to start? May I ask Lisa, Sida is active. Sida is always facing this question of corruption, the risk of it.
Yes.
How can we see?
So, I mean, this is a tricky question, and it's always a relevant question to ask, and to make sure from start to finish that we always keep this this question in mind. Also going back to who do we want to reach and what are the impacts. So one example that we do is to support research and evidence to explore and to learn more about what are the impacts of different types of social protection programs, often focused around the social cash transfer programs, but this could probably be expanded to other types of programs within social policy as well. But to make sure that we always continue to learn about the investments that are made in social protection, and where do they end up, and who are they impacting in what way.
There's also a question from Gunnar Axelsson Nikander, which might be connected in the sense that it has to do with working with governments. Do you see a relationship between government willingness to co-finance, to sort of step up and take their share and take over programs, to which a relationship between that and the extent to which a social protection program is narrowly targeted? The idea might be that the broader programs covering larger portions of the populations are easier to put priority on.
This is a good question. I don't know if I have a very good answer to this specific question about correlation, but one thing that I wanted to mention is that there has previously, and it's still in some countries, there have been a lot of myths around social protection, especially social cash transfer programs, and what they may lead to. For example, that people become lazy if they receive cash transfer program, or that you buy alcohol and tobacco for the cash transfers. So one thing that, I mean, coming back to the question around learning more about these programs, and what they do not lead to. But I mean, that is it's an important way to also influence the direction, and open up the discussion with the different types of partners around what social protection is, and what type of social protection that is more efficient.
Miguel, do you have any reflections on this?
Yes, Mats, and thank you very much for the questions. I think these are really at the heart of the strategies that, in a way, we have to think about how to improve the way we engage with governments. And I think when I mentioned that the donor support to enhance and expand social protection systems most likely will be better sustained in the future if they are introduced in parallel with other interventions that not only improve the fiscal space, as I was referring before, but also the institutional capacity. And what I mean institutional capacity is not just systems that help to deliver these programs, but also the governance and accountability structures. So how to embed these programs into legislation, sometimes even under the constitutional laws and rights that citizens have. And the reason is because programs that don't have these legal characteristics are more likely to be vulnerable to decisions or discretionary decisions by governments. So in relation to the question about corruption, this is critical, because when you have systems of governance that involve several actors from civil society or parliamentarian actors, for example, that constitute the check and balances of policies, can really help limit corruption in these cases. And also, I think there is one important aspect, which is how donors get involved with elites or leaders. So also the dialogue with elites, and to highlight the importance of precisely finding the incentives for making sure that these programs are implemented properly is going to be key, because they have incentives as well to keep those programs under a situation that are not fully institutionalized. So there are several things, but I think working on governance and accountability is key, and also how you get involved different actors is fundamental.
Okay, thank you, Marion. You would like to say something? I would like to throw in a rough question to you as well, that you can answer as well. What do you think, if aid dried up, how much would be left of these programs? Mm-hmm. Okay, but first the other one.
Yeah, first, I think, I have a different opinion to Lisa's and Miguel's answer, especially about effectiveness of social protection. And my view is that for as long as social protection is, especially from my part of the world, which is Africa, so long as social protection is donor-led, it's donor-dominated, it's donor-driven, social protection is not going to be effective at all. And number two, unless it is within, not in parallel, unless it is within the broader social policy and social economic architecture of a country, and it's seen as a standalone working in silo from other policies, then social protection is not going to be effective. And I think this is a question that we will come to over and over and over again. It has to be embedded into national processes, and it has to be through democratic processes also. I think we have to think about that. The second question that you raised, I think that's the true test of ownership of social protection or cash transfer programs on the continent. And I would also be curious, if donors' support dried up today and the taps closed, I don't know how many of those programs would stand. I'm so sure maybe only 2 or 3, but all the others on the continent, I'm not sure whether they would run. My sense is that there would probably be, there would be no funding, and governments would actually draw back. So that's a test, I think, in terms of ownership.
There is one question also coming in here that sort of moves to the other end of this donor partner country relationship. Many governments in Europe seem to be moving to more towards what you can call a development through private entrepreneurship and markets narrative in their development cooperation. What would be the role of investments in social protection in line with such a narrative? Anyone? Miguel, you seem to be moving on that.
Well, so just to understand, so the question is about the move from donor countries towards a more market-oriented approach. This is what I'm saying.
Putting, as I understand it, putting more emphasis on private actors rather than on the government as a partner.
Yes, I think, my personal view is that governments cannot work in silos or in isolation without other actors. So in every single country around the world, states rely on different actors, the private sector, the civil society, workers' organizations, NGOs, to make policies more effective. So there is, I am actually against the idea that the government should be the only actor involved in the provision of public goods. But I think the extent to which the private sector is involved and how they are involved and under what conditions is a key question. So there are plenty of experiences about how the private sector can make certain processes more efficient, no? Because the state is not specialized in certain areas. So in those areas, I think I have no problem with that, no? I think the question is when key areas of social delivery or public social delivery is channeled or privatized is when things become more complicated. Also, when you privatize the health systems, no, or when you privatize education, then it's becoming more complicated. No, but if you, for example, get involved private sector to distribute certain aspects of a public policy, I think this is totally fine. But depending how you see this involvement in the private sector, no, I am really against, for example, going back to the issue of cash, which I think we are talking about social protection, not just about cash delivery. We are thinking about access to healthcare. We are thinking about, for example, other policies that are part of the social protection framework. But if the delivery of certain cash is through, for example, debit cards, I am in favor of that given in cash, because we have plenty of experience of how inefficient and also risky is to have direct interventions in this area. But I think depending on what is the partnership with the private sector that the person in the audience has kindly asked the question is the answer. But yes, this is what I can say.
Okay. There is a question for Lisa from Britta Olofsson. Sida is implementing strategies that the government decides. To what extent do these strategies decide what countries or the details in the programs? Have you specific directions from the government in doing this?
So of course, I mean, as Sida, we're working against the country strategies and the global strategies, and in countries in Africa, as an example, because those are the strategies that where many, or at least a few, include social protection as a specific goal. But even those strategies that don't explicitly mention social protection often include goals as inclusive economic development, and even in the environment and sort of climate context, social protection can be included in those goals as well, because as I mentioned, we see that social protection is an important safety net in terms of climate change, and in relation to employment as well, and finding a safety net in terms of lack of income for different reasons.
Okay, there is also a question directed to Miguel specifically. But I think this is something that we can discuss more broadly as well. So why did you not include the dynamic COVID era in the analysis? There are a number of initiatives, agreement to build back better, etc., coming from that. So it seems to be a very dynamic period, but not included in the report. Why?
Yes, and thank you again for the question. I think it's a good question. Well, the answer is very clear. No? So we don't have enough data yet to incorporate the analysis in the report. So when we were conducting this study, we were still under COVID, no? So data was still under production. And of course, there've been important initiatives by, for example, the World Bank and the ILO to track how policies have been implemented. And, but for example, just to reflect upon this question, during COVID, developing countries implemented around 4,000 different programs across the global south, no? Well, including the north, countries in the north as well. So it was about 4,000 responses to COVID were introduced the majority of them were usually one-offs or short-term strategies. By the early 2020, to my recollection, just about 20% of all these 4,000 policies and programs were still or remain in place. Today, just very few continue. So I think the COVID has given us very important lessons in terms of how, or the importance of social protection to respond to shocks. And this is a very important lesson. And also how the shock allowed countries to continue expanding or implementing new strategies or new programs. The evidence so far seems to suggest that most of the policies were short-term, and unfortunately they didn't take off. But also that reflects the nature of the shock. So many of them were really in the area of health that also just added existing services. But the reason, going back to the question, we didn't include the COVID because the data didn't allow to do a more rigorous analysis on that. Hopefully, in a couple of years, we will be able to do so with data.
Okay.
But
as we know, you are very rigorous in your research, so that's a very good thing. But you showed also a slide that there have been peaks in coverage during crisis periods. So we can expect that to be the case also during COVID. And that poses the question also why we as international community is not able to be more sustained and prolonged, why the systems are not in place. So that's a challenge. Lisa, you would like to act on that, and know Marion as well. Lisa first.
Yes, I wanted to say that I think it was interesting to read in the report that there were similar challenges related to the lack of systems in place in relation to the shocks like the financial crisis in 2008, for example, and looking at evidence from the COVID-19 pandemic and the socioeconomic consequences, that was still an issue 12 years later, even though a lot had happened during those years. And I think this indicates that there is need to continue strengthening the systems since we can count on more shocks going forward.
Okay, Marion.
I think from a policymaking perspective, what my thoughts were is that, it is quite clear to see the way countries have been I've just stuck to the same path that was created. I think COVID provided an opportunity for most countries to relook how they do policy and how they do social policy, for example. So, I think we expected that maybe there would be an expansion of healthcare, universal healthcare, for example, because COVID was a lot of things, economic crisis, a healthcare crisis also. So we expected maybe that there would be an expansion in healthcare. But then in healthcare, an expansion of programs that then reach informal people who are working in the informal sector who are mostly affected. But then after COVID, what we saw is that countries just stuck to the path that they already had, programs that were initiated were cut down. And so I think we also need to think about how policies, sometimes good or bad, can be very path dependent, that it's very hard to break away from them and create better systems. So I think that's a lesson that we could think about in terms of COVID.
Thank you very much. I think today we have learned that social protection is a modality that is effective when it comes to reducing poverty, but it might be seen as an isolated or targeted intervention approach, but it also relates a lot to policies in various ways, both in the countries where it's implemented, also in donor countries and parts of foreign policies. So we really, through this, get through a lens where we can see a broader picture of the development challenges of poor countries that are exposed to shocks from outside, in need of protection, in need of systems for human rights reasons. So I'd like to thank you very much, all of you, Miguel, for the presentation, the work with the report, Lisa and Marion for your contributions in this panel. There is a report that you can download from www.eba.se, hopefully also with some attachments where you can find all the econometric discussions and methodological arguments. However, there's also a possibility to come to a next EBA seminar, which will be held on the 23rd of May. It will cover the theme of payment by results in aid. EBA will also co-arrange a Swedish launch of the World Development Report 2023 on migration and development, and that will be on the 29th of May. You are welcome to visit our homepage where you can find all the reports we have published and also follow our podcasts and other interesting materials. Thanks for today and welcome next time. Thank you.